People who have COVID-19 can leave isolation after 5 days if they are no longer experiencing symptoms, U.S. health officials said, cutting the previously recommended period in half as the Omicron variant spurs a jump in infections. The Centers for Disease Control and Prevention said in a statement Monday that following the initial 5-day isolation period, people with COVID-19 should wear a mask for another 5 days when around other people. The new guidance supplants previous recommendations that said people who have tested positive for the virus should isolate for 10 days. COVID-19 cases are expected to soar in the EU following the holidays, threatening to upend the lives of workers and students who are infected or exposed to the virus. Shorter isolation and quarantine periods will allow people to return to work or to school sooner, potentially helping reduce widespread disruptions that could close schools or snarl supply chains. Studies suggesting that illness caused by Omicron isn't as severe, especially for people who have been vaccinated and received booster shots, has increased pressure on public health officials to ease their stance on when infected or exposed people can return to their routines. Last week, the CDC shortened its isolation guidance for healthcare workers, saying those with mild or moderate COVID-19 could return to work after 7 days with a negative antigen test. "This is terrific, consistent with the evidence and data for contagiousness," tweeted Ashish Jha, Dean of TH. "And exactly what our country needs right now." The CDC's shift in guidance was motivated by science showing that the majority of coronavirus transmission occurs early in the course of the illness, in the first day or two before the onset of symptoms and the 2 to 3 days that follow, the agency said.